welcome to the Love is the Cure Foundation podcasts. I'm Alfonso Vega.
And I'm Lyndell Vega.
Our goal at the Love is the Cure Foundation podcast is to have conversations that are valuable to families as they go through their own pediatric cancer journey. On today's podcast, we are talking to Leah Terrill. When Inigo was transferred from Boston Children's Hospital to Spaulding Rehabilitation, Leah was one of his therapists. Leah was such an important connection for us and Inigo. Her energy and vibe was uplifting for us. So much of what she did for Inigo kept his spirits lifted, and it was because of Leah's guidance and communication about adaptive sports that we started on the path to get Inigo his recumbent bike, which he loved so much. We feel that recreation therapy is incredibly important for children dealing with the effects of posterior fossa syndrome. With this in mind, we wanted to talk to Leah to understand the importance of rehabilitation therapy, and we are doubly lucky because she is also a child life specialist. Thank you for joining us today, Leah.
Thank you for having me. I'm so excited to be here.
Leah, so our first question for you is just tell us a little bit about yourself and what it is that you do as a child life specialist.
Yeah, so a little bit about me. I've been a child life specialist and recreation therapist for almost 10 years. I did my graduate program at Springfield College, where I did a dual degree and got certified in both, which was really wonderful. And a little bit about child life for any listener that is not familiar with child life. We are certified clinicians and we're educated in child development, family systems, the importance of play, and the impacts of trauma and hospitalization on children and their families as well. And so the role is generally geared towards hospitals, but actually can be found in a lot of other places nowadays because our skills are applicable to so many child-oriented organizations and things like that. But our role is really to support children and families through the difficulties of hospitalization and normalize that space for them and use developmentally informed practice such as play to help them cope and understand and really learn about what's going on and make it a lot less stressful.
And so what was your inspiration that drove you to this career path?
So I was interested in art therapy when I was doing my undergrad degree, and I learned that it wasn't really exactly what I thought it was and it wasn't really what I was looking for. And I liked hospitals, I liked working with kids, but I had never heard of child life before. And a friend of mine had personal experience with it. And she was like, "Oh, do you know what this is? Have you heard of it?" And I hadn't. And I connected with somebody, did a little informational interview, thought this was, right up my alley. And then I fortunately had an internship at Dana-Farber when I was in my undergrad with a child life specialist and fell in love with the field and everything that they did. So from there I was hooked and I went to grad school and found the recreation therapy piece as well, which kind of tied back to the art therapy that I had always originally been interested in. So it came kind of full circle and yeah.
No, we're so glad for that. We definitely learned the value of what child life specialists do in the hospital, especially for our son Inigo during his whole journey with this diagnosis of a brain tumor. So
Yeah, so pediatrics pulled you in, the kids.
Yeah,
it's always the kids.
It's always the kids. I had a big desire to work with kids, but I wasn't really, I wasn't really feeling the teacher or daycare kind of aspect, and I really had always liked the medical field, and so just fit perfect.
That's great.
That's a big step to go into. Well, I guess we can get into rehab in a little bit, but from child life into a situation where you are making a safe space for kids in a hospital setting where they otherwise are scared or afraid, or it's really interesting that you turned your art interests into something like that. It's pretty cool. Yeah.
So tell us a little bit about the importance of play again in that safe space for kids in these situations.
Yeah. That's a great question. Because I think there are two ways of looking at it. There's almost like two answers, and there's the textbook clinical answer, and play is an essential part of child development and growth and learning. And that's how they kind of process their environment and take in new information. It's how they express themselves as well, right? All through play. You can observe a young child's play and, if there's aggression, where's that coming from? And if there's, misconceptions about whether it's hospital play or something else, you can help clear that information up. And, those things are fundamental reasons why play is so important. Helping them cope and process all these big emotions that they don't have the language for yet, or the, maybe the awareness for, this is a feeling that I'm having, and, I don't know what it is, but I'm mad. And so I'm going to hit these blocks or something. So there's that part, but then there's also the anecdotal answer of all the things I've seen over my 8+ years working in the hospital. And every day, every week, I get the honor of witnessing children, how play, specifically intrinsic play, where kids just get to do what they want, can have on their kind of trajectory, and their kind of their affect. So oftentimes I see kids come into the hospital and because I'm in rehab, we see kids usually after they've been in an acute care setting. And so they've already been hospitalized for a long time. And then they come to us and, we don't know anything about them yet. We don't know what they were like before. And so we're really dependent on the family to tell us, okay, who is your child? And, what should we expect from them? What are the things that they love to do prior to all of this happening? And so just taking time to carve out time for play, can really just, take a child who is struggling to participate in therapy, struggling to interact with members of the medical team, giving them time and free play in the playroom within a couple days can turn that around. It's hard to describe, I feel like, but I've just seen it just shift so quickly when they have that control over decision-making and the things in their environment, whether it's making a mess and, not having to clean it up, or nobody telling them that they can't do that, or it's playing with dolls and, trucks and things like that. But giving them that opportunity to really gain control over their life in that moment is extremely important.
So I want to go back to something that you said there. Every child is different, and it's not one size fits all. What is your process as you go in to evaluate each of these kids? You kind of said you connect with the family, you expect the family to kind of lead you down that path. But what is your evaluation process?
Great question. When a child comes in, I meet with the family and the child. So, depending on the age or the level of the child and how they're communicating in the moment, whether it's different or not from baseline, asking questions about how the hospitalization's going, how the previous hospital was, getting that background information, and then really just, okay, if you were asking questions about what they would do at home, if you were home and, you could do anything you wanted for the day, how would you spend it? Or if they, where do they find support? Who are their friends? What do they like to do for fun and in school? And just trying to dive into all of those aspects of their life to see where, what sparks joy when they're talking about it, or, is there something that they could really carry on a long conversation with, whether it's from the parents or the child, but really trying to find out who they were before the hospital, so that we can bring that back into their hospitalization and regain some of the normalcy that they had.
I think something that is probably not unique to us, but you can help us understand this. Inigo was nonverbal when we came to be with you guys. And so we understand that we had to be, and that was our goal as parents, we had to be his voice in so many ways. not only was he nonverbal, but there was also some cognitive processing delays going on at the time because of the effects of posterior fossa that he was dealing with. I'm assuming you deal with this often, maybe not posterior fossa syndrome, but nonverbal patients. You're trained to deal with these things. Your assessment of how difficult is that, or is this where we want to voice to parents how important our roles play in this type of situation?
Yeah. It's really a team effort. We rely a lot if they're a previously speaking child and they've lost their voice for whatever reason, cerebellar mutism or some other type of injury. If they've lost their voice, we rely a lot on at least having the parents help us get started, and then as a team, our speech therapists, that's hugely important. Working to, as quickly as possible, get them an independent method of communication, whether that's writing things down, using an iPad, using a letterboard, or just thumbs up and thumbs down. So at least we can have yes, no questions answered. And from there, if the parent can guide us on some interests and things like that, so we're not constantly asking them the same questions over and over. But because that can be frustrating for somebody who, previously could talk and they can't share all the ideas that they have in their head. Being able to just figure out some system where then we can just take it from there and, okay, we have a thumbs up, thumbs down. Great. Now, we'll ask, back and forth, favorite things to do, and we can assist with giving ideas. But really, parents are so helpful in that aspect so that we are led in the right direction versus trying to, and coming up with things that, a kid might be interested in without us knowing them very well in the beginning. Yeah.
Yeah. So that's something that we want to make sure that we voice to other parents is really focus on being a voice for your child if your child is not able to do that for themselves, because it will be important in the connection that they have with their care teams, with their therapists and specialists that have to deal with them. I remember one of the things that we did as a family is we made a picture wall. And my idea behind that is I went home once Inigo was diagnosed, and I got as many pictures as I thought that I could that would show Inigo's interests and kind of who he was a little bit. And so I would, wherever we were, I would build a picture wall in his room. And the idea behind that and what we had discussed was if you guys could walk into that room and whether there was a medical conversation going on about other things, you could spend a little bit of time and look at those pictures and kind of get a feel for who Inigo was and who he was before diagnosis. And something that we noticed about you is, and I think it's anybody in the field that you're in, but specifically, you came into our room and you spent some time at that wall. And you were just looking and kind of trying to understand. And, it's neat to see because we were trying to get people to look at that so that you guys can understand that the little boy that you see in front of you is still that little boy that you're seeing on those pictures on that wall. And we were hoping in some way, shape, or form that would inform your ability to maybe spur something in him as he would, try therapies or whatever it was. So that's what our very small addition to the process.
Yeah. And I mean, that was a wonderful addition. I still remember those photos. And I think that's how I found out about his love of Sasquatch and Yetis and biking. It's definitely helpful when parents can do something like that to add that information to their room or wherever, so that, again, they don't have to continuously tell people about it. And because that can be frustrating. And so having visuals is great. And a good reminder for the child too.
Mm-hmm.
we also do something, a lot of hospitals do this, I would say, like all about me posters or things like that, where it's a lot of writing. You can fill it out, favorite color, favorite animal, people that are in your family, do you have pets, that sort of thing, which is also nice, but it's very much a template. And so it's hard to individualize. You can write whatever you want, but it's harder to individualize that. And the photos give so much more of a story.
We just love that kid so much. And so we really just wanted to show you guys everything.
Yeah.
Like, this is who he was. This is what and we would tell him, you're going to be back there.
Yeah.
You're going to do all those things that are, I just want to point out to anybody watching on the podcast that there's someone in the room that may have a Sasquatch shirt on. There may be two people that have a Bigfoot
Where'd
shirt.
those come from?
We love that. That's so cool. Yeah, we had some pretty good conversations. And Leah, correct me if I'm wrong here, but you were like, who's Sasquatch?
I was going to say, I honestly don't remember, but it's funny. I saw a Yeti today on something that, and I was like, I haven't seen a Yeti in a while. Like, what perfect timing.
I still remember we were at his bed and you were across from us. And I remember having that conversation on Bigfoot and telling you Inigo's favorite movie, Harry and the Hendersons, and all that sort of stuff. Yeah. And yeah, you were very open to us having that conversation. I love that, because I'm sure there's a lot of instances where kids and families bring something to you that you are just like, I don't know exactly what you're talking about, but I'm open to.
I want to hear more.
Yeah. No, it was awesome. And an amazing thing that Leah did. They gave us a beautiful Christmas at Spaulding. The best Christmas you could have, of course, if your child is in Spaulding. And it was just wonderful. But Leah made sure to pick out all of the Yeti and Bigfoot gifts.
Games.
To make sure that as Inigo opened presents on Christmas morning, we had all sorts of Bigfoot stuff. And it made that kid, it was so
he's so happy.
We like to make sure that they get personalized gifts.
Yeah, it was great. Well, you guys definitely tuned into him and to us and what his interests were, and you made us feel very special.
But that's the thing, you do that for every kid. And that's what I find amazing about what you all do is you make this about the kids. You make it about each individual child. And for children that are going through some very difficult situations that are at rehab, it must be amazing for a child to feel that at least for whatever world they're having to live through at that moment, it's really about them. Mm-hmm. And I think that's really special that you do that.
Thank you.
So we wanted to just talk about, there's a major difference we had to deal, and so many other families and kids have to deal with two different worlds. We come out of a medical world where Inigo was in an acute situation. We were dealing with some very, very difficult medical emergencies at the beginning of his diagnosis. And we finally reach a level of stability. And at this level of medical stability, the team at Children's readies us to head off to rehabilitation. And this entire time, we're telling Inigo, this is where everything changes. We can finally, after 4 months, we can stop focusing on the medical and we can just focus on walking and talking and playing again. And one thing that we did not realize moving into that facility is that we were going to be able to focus on Inigo's number one love of riding a bicycle again. When Inigo was diagnosed and seeing him fall into cerebellar mutism, I thought we'd never ride together as a family, and it's a major part of what we did. It was a major part of who we were. So here we are moving out of an acute medical space into a rehabilitation unit where it is solely about getting better. And that was something that Inigo completely took by the horns. Mm-hmm. And he was so happy about it. The special thing about you is that you are different because you weren't occupational therapy, you weren't physical therapy, you weren't speech therapy. And so the work that you were making him do was plain, and it wasn't making him do anything. And it was more about like, what are you about, kiddo? Let's do what you're about. Let's do what this and that, the other. But you came one morning and you said to Lindy, I must have been off getting breakfast or something. And you said, I see that Inigo loves to ride bicycles. Is there any chance that he would be interested in a spin class? And from my recollection, what Lindy told me is that they were like, yeah, definitely.
Immediately, yes.
Inigo was indicating, from what we were told when we went down to the spin class, he was the first pediatric patient to go down into that spin class. What was your thought process behind, this isn't just about him riding some sort of trike that we might have on the pediatric floor. This might be something that we can turn into a field trip and kind of turn into like a normal day process, like school, where we get to go somewhere and it might be a lot of fun. Like, what's your thought process behind that?
Yeah. I mean, when somebody comes to Spalding, adaptive sports, especially now we have more offerings, but it is one thing that is on my mind immediately, because it is, it's a form of play, but it is a level up, essentially. It's, it is not that sports are for only older kids, but it is more important to older kids, I would say. Like, the play changes and becomes more competitive, or becomes more of an interest and things like that. So I think about adaptive sports for a lot of kids. And generally I broach the subject with them. I try to, if they seem like they'll be ready for it, try to early on, so that we can get them exposed to it. Because I feel like inpatient exposure to these things really can change the trajectory or the interest of the person. And sometimes people aren't ready. So, Inigo was so excited about it and ready to get back into it. But sometimes there are kids who feel like they need to warm up to the idea, whether they aren't an avid biker, and so it's a little bit nerve-wracking, or they were an avid biker and they are disappointed by the change. And so, I introduced the idea early on, basically, so that we can feel people out and slowly, hopefully, get them to come around and want to participate. Because again, it's just so crucial to play and a different form. And for a lot of, again, as you get older, a lot of people just, it's a part of their life in some aspect. And so any version of sport, in my opinion, is, even if it's not the same one that you were doing, it's still extremely, valuable, and has the same sort of, or it can have the same sort of social impact and emotional impact. And again, when you're trying to physically recover from something, that has affected your entire body, being able to do something that you never thought you could do again is also really, I feel like inspiring for a lot of kids when they're in the rehab setting. So yeah, anyway, I try to answer your question, I try to think of it immediately, and slowly introduce the idea.
No, that's great. No, with Inigo, like you were saying, finding that motivation, how it changes emotions. We just saw him transition, like Alfonso was saying, from being an inpatient in the hospital into rehab, and, pretty early on realizing the change, like, oh yeah, this is different. Like, I don't have to really think about getting an infusion today, or having to get, all kinds of other medications, or having to do this or that therapy. He was more focused on therapies, in the sense as it was fun. You guys made it fun for him. That spinning class was just the highlight. I mean, that's when I think we started seeing him smile more, becoming more physically active. We think even spurred his physical abilities even more. Like, he was trying harder to do more with his hands and get walking again. So it just changed everything. I mean,
yeah, I won't forget the smile in his class on that first time. He was.
Yeah. I tell the story about how we get down there and
we were the first ones there.
he was so excited.
Nice
He
and
didn't want to be
early.
late, and he would indicate at that time, like we got to go. and and it was just so interesting. A child that is nonverbal figures out ways to be communicative, and he had figured out in very many ways how to help us to understand that he wanted something, and you had given him a gift, and it was this idea of, number one, I get to get off the floor. Uh, number two is I get to go and I'm gonna do something that I've never even done before. But we would walk by these recumbent bikes downstairs, and I was explaining what they were, and he wide-eyed, very excited about it, but you can't take those around and stuff, they're locked up. And so we get down to that floor and we got there first. No one was there. Some of the instructors were talking, but no other patients were there. And we see the tiniest recumbent bike, tiny little recumbent bike. And I see one of the instructors like realize who we were, and she comes right over and she's all excited, and you're with us, and you guys are talking, and we wheel Inigo right over to that recumbent bike, and I remember he stands up, and Inigo was so tall, and I remember she turned and looked at us and goes, "Oh."
She's like, I was told he was like 9 years old. Oh yeah, he is. He'll be 10 coming up, but yeah, he's 9. She's like, oh my goodness.
Yeah. But he folded himself down into that thing, and for 45 minutes sat there and was so
he rode hard.
straight. We have a lot of pictures of that. Maybe I'll throw some up on screen. But I remember whispering to him that the lady across the way was trying to beat him, and so he would spin a little bit faster or faster.
Yeah, competitive spirit was.
So I think it's interesting what you're saying, that you use that competitive spirit, or excuse me, I don't want to put words in your mouth, but do you use a child, especially as they're getting older, that competitiveness to kind of bring out the rehabilitation process?
Yeah, absolutely. Yeah.
We saw that with him. So.
And I remember him graduating very quickly to the adult size bike. We're like, maybe PD size is good. And no, he didn't need it. So he fit on it, but he didn't need it. Yeah.
So Spalding is really special in that it's not really a medical facility, right? Can you explain to us really the goals of Spalding, especially when it comes to children on that pediatrics floor? What is the goal here? Obviously, it's not medical. What are we looking for?
Yeah, absolutely. The goal is really to restore as much function as possible. And if that's not 100%, make them as independent as possible in the time that we have. And so getting somebody, if they can walk, that's, great. Or, we're working towards walking, that's great. But if they could be more independent using a wheelchair and they can get themselves around that way, then we also want to use that. So we're not just focusing on getting 100% recovery or, aiming with this one goal and forgetting about them leading their lives and being as independent as possible. Obviously, children aren't technically independent. You would say, like when you're helping somebody transition home, like children would never be independent because there's always, supervision and things like that. But how can we help them become as independent as possible in leading the lifestyle that they do? And if that's with an assist of a wheelchair, great. How can we make them as independent as possible in their wheelchair? So really trying to just motivate people to restore function and as much as possible within the time that we can.
That was important for Inigo because honestly, it was Inigo's recumbent bike that gave him the first autonomy that he had had since he was diagnosed. And for us, it was an eye-opening situation because Inigo was a very independent child.
Yeah.
And when we talk about avid cyclists, it was something that he was asking for us to enter him into races. We were looking for clubs for kids his age and that sort of stuff. He was the kid that we would show up at Thunder Mountain, and we would get to the bottom of a run, and kids would come around and ask him like who he was and all that sort of stuff, right? So he was one of those kids that was such an avid cyclist, that then to have a situation like this where all of that is taken away from him essentially, and then for you to offer a possibility of something that even looked like that, I think was a real testament to the observation skills that you all do, and also you specifically at Spalding, to understand what is it that a child is going to desire to do. Because it's almost, if you can figure out what the carrot is, they can almost do a lot for themselves, in that, so much of rehab, I would say, and correct me if I'm wrong, is about positivity and desire. And if you can build that in a child, yeah, go ahead.
Oh, no, I was just going to agree with you. I think, there's a lot of challenging situations that we see in rehab, whether it's posterior fossa syndrome or, a brain injury or spinal cord injury, things like that.
Yeah, we understood that cycling was that carrot. And if we could just build the positivity around that, being able to have that as an activity again. And the simple fact that you took the time to speak with us, to understand, like, these guys aren't just talking about, like, let's go teach a kid how to ride a bicycle outside. These guys are talking about cycling on a different level, and we can offer something to him. And I thought that was eye-opening, because you never treated it as something that was, oh yeah, cycling, that's what all kids do, they go ride a bicycle. You treated it, and of course, I think this is what you all do at Spalding. You cue into these things, whether it's a different elevated play or, whatever that case may be. You understood to cue into that with him, and you took it somewhere else. And that's what we appreciate with your observation and understanding of, I don't want to say your patient, but, in this particular case, it was observing what might spur Inigo to work harder, to feel like he's getting better,
Right. And quality of life is something that kind of drives what I do. And I think what a lot of us at Spalding do, and a lot of us in rehab, we're working to, yes, restore function, but also quality of life and what matters to that person. And, whether for whatever type of injury that, somebody's coming in for, you still try to, whether the goal is, 100% function or there's a new long-term disability, helping them find ways that they can enjoy life, and access the things that they want to do.
We just look at Inigo's trajectory over the 20 months, and it's pretty near impossible for us to imagine what his recovery would have been like without this recumbent bike. And we can't. It did so much to benefit all aspects of his life, like you're talking about, his quality of life just, shot up after that, because he did regain that independent part of himself that he had lost.
And I remember you would link up with his physical therapist, and you would say, you would come to our room and say, hey, what do you guys think about going riding the bikes today? We'd say, yeah, of course, and he'd be so excited about it. Of course, we had to work on other stuff, balance issues and that sort of thing. But the strength that cycling gave him was incredible. So then when we left Spalding, here he is starting, because we left you and we went directly back into Children's Hospital. We never went home. And we began systemic chemotherapy. And so in systemic chemotherapy, you and I had a specific conversation about acquiring a recumbent bike. I'll leave it there, but there was a lot more conversation in there. And we made the decision that, we weren't going to wait for other systems to help us. we worked really hard at trying to, there's charitable systems out there that help kids, that help families acquire these sorts of things. We never found the right fit for us. We never found a fit specifically for someone with cerebellar mutism. It didn't fit into a spinal cord injury diagnosis. It didn't fit into so many of those things. And so we never found the right fit. And I'm telling you, I tried. I tried so hard.
Yeah.
And I know that you came to our room a few times to go over links and sources and possible income streams. And we couldn't figure it out in the end. And so we made the decision as a family that we needed to do this. And so we decided to. And so here Inigo, in the middle of systemic chemotherapy, receives this recumbent bike, because at the time we were at the tail end of the pandemic, really. And so here I was ordering a recumbent bike, and it was going to take months,
4 months, I think,
months to get here.
Yeah.
And our concern was, and our situation, but we didn't want to run out of time. We wanted him to, for whatever time if he rode that bike once, that would have been absolutely worth it. And so we were concerned. And so here I am ordering this recumbent bike, and I wanted to get something specific to him. And because he was an avid mountain biker, we got a recumbent bike that had full suspension. It had suspension in the rear, had suspension in the front, and this enabled Inigo to ride the mountain bike trails that he used to ride. Of course, he couldn't ride some of the really technical single track, but he could still do some of the wider double track and that sort of stuff. But he rode up Mount Wachusett 3 times in the middle of systemic chemotherapy, a 6-month course of it. Here he is at month like 3 or 4, climbing Mount Wachusett, and then Lindy yelling for him to slow down because we couldn't keep up with it.
Yeah, he put us to shame.
Yeah.
The autonomy that it gave him was one of those things that I think it's so wonderful what you're saying, that your goals are quality of life, functionality, being able to just do things again. And you do that in the adult space, and here you are doing it for children as well. And we just saw it incredibly useful for our family. I mean, we would do every rail trail we could. We would do them all over Concord and all over Central Mass, really up in
New Hampshire,
into southern New Hampshire. We have a drone, and it would follow us as we would go through all these rail trails. So I have a lot of footage of him on his bike, like doing all these rail trails. And one of the things that we talk about is we were going down a trail one time, and there was a side trail that had a jump. And I didn't know, because I'm ahead, Inigo's in the middle, Lindy's behind, and I hear a bunch of commotion, and I turn around to find out what's going on. And it's because Inigo had shot off to take the side trail. He wanted to launch himself off this jump.
I love that.
We think about it. I was good with it. I was totally good with it. Lindy was freaking out.
Thinking about like platelet levels and all these things. I'm like, no.
Yeah, I mean, but here he is. He's got a full helmet on. He's got all this sort of stuff, and I'm like, yeah, it's all good. Let him live it up, And he launches himself off this jump, and it was just, we can absolutely be thankful for the goal that you all have to give someone autonomy, to give them in some form of independence if possible. And for us, we only ever found it on a trike, on a recumbent bike. And so for us, I think that's really wonderful. So we can kind of get into the adaptive sport conversation if we can with you.
Yeah.
We know that you came from a different space. We know that you were part of an adaptive sports program before. And I don't know if we communicated that we were going to ask you about that, but what is the idea of using adaptive sports in children and adults as well for added functionality?
Yeah. I think people often don't know that you can adapt sports, which, like, if you didn't need it, why would you really think about it in that way? And so, but kind of as I said before, I mean, sport is just another form of play. And as you get older, it becomes more of a I'd say like a normal version of play, right? We don't think of it as that anymore. It's now a sport. But it is still that release and a joy and benefit. And just as important as play is or sport is to an able-bodied person, people with disabilities from, again, whatever source deserve that as well. They, need, I was going to say they deserve it, if not, more, because it is such having a disability can be difficult. And so having a space where you can do something that brings you joy, that brings you social opportunities, that brings you connection and competition and physical fitness, all of that is so incredibly important. I think, to anybody of any age. So it's essential.
Yeah. One of our goals is to communicate to parents, specifically with children that have cerebellar mutism, the importance of therapies, the importance of figuring out what would work for your child. And of course, with their medical care teams and with their therapists, what adaptive sports could be possible. And I know we saw some things while we were there that we thought was really cool. We know that you guys do swim therapies. We know that you guys, one of the things that he was really fascinated about was the hockey program that you guys have there. Do you want to say something about that? We thought it was really cool. It was nothing that we could ever end up doing, but we thought it was so cool.
Yeah.
And he loved watching YouTube videos of it.
Yeah, I mean, it's awesome. Sled hockey is such a cool sport. But they're actually, Spalding is kind of increasing their pediatric sled hockey team and opportunities. Cool. So that will be cool for the future. But it is such a cool sport to watch. So I'm glad he was watching YouTube videos. It was awesome.
Yeah.
Oh, yeah. We had to research that when we saw that.
What is that?
He was stoked, man. And he couldn't talk at the time, but he was like, that. I wanted to try it.
Yeah. I have a question for you guys. I'm curious, did you know anything about adaptive sports prior, or recumbent cycling, anything like that prior to coming to Spalding?
Well, we knew it in the realm of because we're also road cyclists, yes. So we knew it in the realm of seeing people ride recumbent bikes, but not in the adaptive space. Lindy has an uncle that rides a recumbent bike, but not adaptively. You know what I mean? As a normal road bike.
Yeah.
Oh, cool.
But no, we live near Lawrence Academy. A big academy in this area, just up in Groton, and they have a huge hockey program. And we have seen they have had tournaments there for sled hockey in the past, but I kind of thought it. When I was a kid, they had you could hire like donkeys to come to your high school, and you could do donkey basketball.
I don't know what that is.
I don't know if you've ever heard that, but they put like rubber shoes on a donkey and you play basketball.
Go in
with them?
Yeah. You ride on their backs and like it's anyway. That's funny. Sorry, I don't mean to go off on a tangent, but
is that adaptive?
I don't think so. I guess it for somebody maybe.
Yeah. No, but my point is that like we are in an area where there are a lot of very interesting like sports going on all the time, and I know that they have had sled hockey tournaments in the area, but I just thought it was like the donkey basketball thing. I thought it was a sideshow, and so I didn't realize like, oh wait, no, this is like when you watch on Chronicle about a wheelchair basketball league or something like that, and I was like, oh, okay. So from then we looked up videos for Inigo about sled hockey, and he was absolutely fascinated and indicating that he would like to try that. We just couldn't figure out any way that he could sit safely on the floor at the time and like try it all out. But no, that to answer your question, I don't think
we didn't know very much.
Yeah.
No.
That's I'm glad you did. I'm glad you learned.
No, listen, we thought we were going to get to Spalding and it was going to be like, let's just walk down a hallway. Let's learn to brush your teeth. Let's, all that sort of, I don't want to say mundane because I understand on so many levels, like that's huge, for
independence and
right
day to day.
But we thought that's what it was going to be. And when it wasn't, you could see it spurred in Inigo an excitement. There was something a lot more exciting for him to be chased around upstairs while he's on a trike going as fast as he can, laughing because he could still laugh even though he couldn't talk. And there, Victoria's chasing him down, like trying to hold on the back of his trike. And it's cool.
Yeah.
Like we're seeing him go happy, like literally happy. And just to see him happy again, like he was playing, I think it was the first times that we ever experienced him playing happy. Lindy and I were dancing bears in that room at Children's Hospital before we got to you guys. And so we were always trying to make him laugh, always trying to do something. But this felt like play for him for the first time. And that's what we loved, what you did for him, is that it really made him feel, no, I'm here to get better. And not only that, but it's fun. Adaptive sports, we're huge fans of it.
Yep.
We're huge. So something that we try to tell parents, once again, with cerebellar mutism is how important it is to work hard through your therapies. We don't know if that's true or not because in all the research that we do, there's metrics that go either way. And I think with cerebellar mutism, I think what I have been able to find as I research it all is that it's not really quantifiable because every child comes out of it at different stages. They only come out of it a certain percentage, but every child is different. We are huge advocates for therapy. What would you say? I'm already going to guess what your answer is, but what would you say about therapies for a child or for anybody that is trying to work their way back from this type of tumor surgery, for instance, with Inigo?
Yeah. I mean, I would agree. Therapy is hugely important.
Right.
It's, it is tough because with posterior fossa syndrome, things can vary so much from person to person, and somebody has all the physical effects but no cerebellar mutism, or vice versa. And so, if a family is offered the opportunity to get therapy, or whether on an inpatient setting or outpatient, not every family is able to come to inpatient for whatever insurance reason or something like that. But it's so valuable, and especially like the frequency and, level of inpatient rehab, I think is really important, especially kind of right after it happens, when things are new. And even though kids with posterior fossa are now undergoing potentially radiation and chemo as well, it's helping them get stronger through that process and kind of fight through that process, I think can also be helpful. I don't really have any data on it myself, but, we see kids who, Inigo didn't have proton beam therapy. No. We see a lot of kids that receive radiation.
We wish we just didn't have time.
Yeah.
Essentially.
So we see a lot of kids who come with posterior fossa and receive the radiation. And they continue to get stronger, even though they're getting treatment. They are getting stronger in therapy at the same time. So they're not counteracting each other, or the radiation's not counteracting the therapy, if that makes sense. It's still helping, especially through a time that is challenging for any child, with all the additional medical things and medicines in their body. But yeah, I think, did that mostly answer your question?
Yeah, I just want to make sure that we are conveying it to parents that, like, you're going to go out there and research this, and it's going to say that there's very little information to say that therapy helps. And Lindy and I would like to push back on that concept and say, it's not even it's not even a metric that can be quantified. How can you measure if each child comes out of it differently? What levels of therapy is going to help or isn't going to help? And we would absolutely agree with what you're saying. Inpatient therapy that you offered at Spaulding absolutely was huge.
Yep. And I think that point that she was making about how it builds strength in a person is so vital to the recovery process of having to go through radiation and chemo, just having that strength there to rely on is so important. Yeah.
Yeah, it's great. Which is what we know we're running out of time with you, and we just have a few more questions. Yeah. I want to ask you a question about systemically with Spalding. So you guys have a very tight team. Will you give us a little bit of the rundown about how your team works, how you guys work together to better inform each other and work through the therapy process?
Yeah. I mean, I'm so grateful for the team that we have. A lot of our therapists and nurses have been there for, 20 plus years. But then we also have a lot of new staff who are equally as wonderful. And so I think, the reason that all of our staff are in pediatrics is because they want to be there, which I feel so lucky to be a part of that group of people. I don't know if it's like that at all rehabs, but the people that I work with truly love what they do and love serving the people and the families that we do. In terms of working together, I think that really helps us. We have like team communication meetings twice a week where we talk about all of our patients. So we're always connecting. And then because we are, as you remember, like we're kind of physically a small unit. So we are always around each other. All of our offices are in the same hallway. And we can just stop by and connect with one another. Hey, this came up in our therapy session today. Like maybe you can talk about it in child life, or hey, I just found out this patient really loves biking and let's get him on the bike. So things like that are easy for us because we are so, our team is relatively small and fairly tight knit in that way. So it is, I think, a benefit of just like specifically where we are, but I think a lot of teams would be like that too. I think rehab has a little bit of a different mindset when it comes to acute care, because again, we are trying to improve somebody's functioning and quality of life and get all of these things improved for that person.
We loved it there. We wish we could have had 4 or 5 more months there, because the growth that we saw with Inigo was just unreal.
Remarkable.
I mean, we went from Inigo laying in a bed, could barely indicate, to like we left and he was riding a bike. He was walking.
Yeah.
Like the last session.
He was starting to form words.
Yeah, the last session he had with speech therapy there, he
made a sound.
He yelled out. Yeah. And we were like, oh, his voice
it's happening.
Yeah, it's happening. And we were like, oh no, we have to start chemo next week. Like we were so freaked out because we thought like, here we go on this trajectory upwards. And then, we knew Inigo had a long course in front of him and we knew it was a long journey. But that month gave him such a reprieve of understanding that, like, I want to fight this. I want to get through this. I can. And the way that you guys run that facility like that, where it is about working hard and getting through it, it was special to see in him the joy that he found at this like eternal gym class is what he said like later when he could talk. And I was like, yeah, that's cool. Like a lot of people, they hate gym class, but for him, it was like, yeah, awesome. Like we're going to be playing all day long. And that's, the trajectory that we saw with him was really special. And it is a small unit, but I don't know how you would want it any differently.
Together.
Yeah.
It just made sense. We were just lucky to get in, and it's kind of like, we won the lottery with that too, but sorry, Lindy's going to ask you some questions.
Okay. So in just wrapping up here, so what is the most difficult part of your job, and what is your most favorite part?
Super loaded questions.
Yeah, I would say that's a tough one. I think the hardest part of my job is, on a personal level, I feel like, and this might also tie into having a rec therapy degree and a child life degree, but being able to provide everything to families or meeting all of their needs, I feel like is a struggle sometimes, or I've been able to identify all of these things, but then I have to prioritize like what's the what's the most important focus? And, that will vary child to child, or family to family. But, we did a lot of recreation type things with Inigo. I think he's actually a good example, but he was also there during the holiday season, and I have a lot less time, which is tough. And, fortunately I know he had a really strong team at Children's as well. And so they could manage some of the other child life things that, I can't remember if you said this kind of before when we were talking or right now, but, we only see him for such a short period of time within his entire cancer journey. And so I knew that other people would be able to manage some of that emotional, side of things and helping him understand what's happening with his body, which I would try to normally do, but it just doesn't always fit in, or, you have to prioritize. And so I think that is the hardest part for me, is like just feeling like I'm not doing enough. So that might be a personal like anxiety or one of those feelings, but it's definitely
It's a lot of pressure. I don't know how you do that.
Yeah.
I mean, 'cause I'm sure you feel this instantly.
Yeah, and you want to be able to offer so much stuff to people, but it's not always possible.
And we will tell anybody that's watching, like, this is real. Like, Leah comes across as someone, when we were there, that really like cared about Inigo, really cared about offering just normalcy to him. And it's in your character. We saw that within you, and it's one of the reasons why we just appreciate how you worked with him, because it really felt like you had cued in on his personality and what he needed, and you were trying to fulfill that. So yeah, maybe he had other teams, from where we were going, but listen, 1 month out of 20 months of that journey with him made such a huge impact on his life, and the way that you work is special. And I'm sure that all parents and families that work with you get that same benefit, and it's a testament to who you are. We think that's awesome.
Thank you. I guess my favorite part is kind of like a double-edged sword. My favorite part is also being able to do so many things. I think it is where I am, partially because as a child life specialist in an acute care hospital, I wouldn't be able to do all these rec therapy things. And, if I was just a rec therapist, I wouldn't be able to do all this other, emotional support and things like that, depending. But so it is what's the word? It is a difficult part, but it's also like why I love working where I do so much. And to answer kind of advice that I would give to a family for the rehab process, I think in general, rehab or inpatient, any type of inpatient acute care hospitalization, almost going back to like the beginning of this conversation, but sharing about your family and your child and what is important to you, because that is the most crucial thing for us to know. It's, whether that's every Friday night you have a movie night, or you have a religious celebration that you want to do, or you love biking and you want to get back into it. Whatever, whatever that is, that's really important for us to know, because it's shaping the priorities of the team. I know I am kind of the catalyst for adaptive sports, but all of our team is thinking about it and able to put a referral into me, and so we want to be able to serve families the best that we can. So whatever matters to you matters to us. So don't be afraid to tell people that and to advocate for it as well. Obviously, medical needs come first, whether something's safe or not, but that's a different story. Just letting us know what is important to you is key.
That's wonderfully said. Just for any parents that are watching, if you guys end up at Spalding, Leah's who you need to know. So she seemed to be the catalyst for us in so many things.
Yeah.
And
we never felt left out.
No. But we definitely felt that she was, you get things done. And we absolutely love that. Where, we were there for such a short time, and it's like, you knew that. You were acutely aware of that, and you made sure that things got processed out for Inigo so that he could do the things that would benefit him, that would be good for him and good for us as a family. So Leah, we thank you so much for joining us today. You're a wonderful person. We love being able to talk to you. And so thank you for sharing all this information with us. It's really special.
I think the feeling is mutual. You guys were and still are a absolutely wonderful family. And so we really enjoyed being able to work with you. And I'm so glad that we've been able to keep in touch and you've shared all the wonderful things you guys did after you left.
We tried. We really cared about you guys. We really did. And he wanted to show you guys that he could talk again. He wanted to show you guys so many things. And, it is what it is. But for him, it felt he knew how hard you guys worked for his journey. And it's like when he could talk again, he wanted to go back and show you guys what his voice sounded like, when he kept asking me did you send Leah the video of me riding Mount Wachusett? And I would say, yeah, I sent it. Like she showed it to the team and stuff. Oh, okay. What'd they say? I don't know. Like I wasn't there, but he cared. He cared that you guys had cared about him. And I think that's what I would say if I could talk to therapists or talk to your team, it's special that you guys show that you care for the kids because they leave and they may never see you again, but they remember. They remember what you did for them. They remembered the journey that you walked with them. And it's important for you guys to understand how special you guys are to these kids. So
Thank you.
that was our show for today. Thank you for joining the conversation. We hope that in listening to our conversations, you will be able to glean information that can be useful for you. If you find that the Love is the Cure Foundation's podcast would serve someone you know, please share our content and support our cause. Our desire at the Love is the Cure Foundation is to help children and families as they navigate a pediatric brain tumor diagnosis. Our experience is with Inigo's brain cancer diagnosis. Some of our conversations may be specific to brain cancer and the residual effects. That being said, through these conversations, we hope to impart practical information that may be useful to a family that may need it as they journey with their child through a pediatric cancer diagnosis, brain cancer or otherwise. Our conversations will continue as we speak with people from different disciplines within hospitals and other cancer situations. We are a nonprofit charitable organization. If you would like to donate to help the Love is the Cure Foundation, please go to our website, loveisthecurefoundation.org, where you can donate and also read about our story and the outreach that we are doing at the foundation. Thank you. And as we say here at the foundation, go love on someone. We all need it.